Hi, this is Nicholas Webb, and I wanted to share some insights and summaries of what I'm discussing at the upcoming National Health Council, the Science of Patient Engagement event. I've been involved in this space for a really long time, and I've seen many different schools of thought as it relates to how do we develop thoughtful, intelligent strategies to be able to gain the insights that we need to be able to improve the quality of care, patient safety, and even clinical outcomes. And it turns out that we are in a time of a strategic inflection point. And what that means is that a lot of the methods that we've used historically, like voice of the customer, patient surveys, and technologies that are really rooted in the 1970s, just aren't good enough anymore. We're in a time where we have a lot of enabling technologies that allow us to get disparate data sets, unstructured and structured data, that we can aggregate and understand the meaning of the way in which patients are engaged across their journey. Now, I also believe, and I believe this very strongly, maybe I could even go as far as to say I know, that patient engagement is an innovation activity. Now, let's take a look at the definition of innovation. Innovation is the process of gaining insights across your customer's journey throughout a range of personas to understand opportunities to identify additional value that serves your organization and your patient. Well, that sounds like patient engagement to me. And so what I want to really suggest here is that we take a look at the discipline of the science of patient engagement, firstly, as an innovation activity, because of course it is. Of course it is. Now, the other thing I want to talk about is the hemispheres of engagement. Now, you could say that patient engagement is the way in which we communicate to different communities and the way in which we understand the personas that we serve. And of course, that's true. But there's another molecule that is associated with patient engagement, and that's providers and staff. Providers and staff are the conduit to patients. They're patient-facing. So if we don't understand them, and if we don't collaborate with them, and if we don't give them the systems and the tools and the processes and the technology stacks, the chances of us improving patient engagement is virtually zero. And we even have a name for this. We call it Human Experience Innovation, or HXI. Human experience innovation is really the future, in my view, of patient engagement. So the obvious question is, what is patient experience innovation? Again, on the foundational premise that patient engagement is an innovation discipline, which of course it is, we have to take a look at the hemispheres of engagement. And one of the easiest ways to do it is to look at the provider and staff, the workforce aspect of healthcare as one hemisphere, and the patients as another hemisphere. These are the two main hemispheres that really create the dynamic of patient engagement. We gain insights from patient-facing stakeholders. We gain insights from all of the staff and providers to understand their communities. And with those insights, then we can instruct HXI strategies to do a better job of delivering thoughtful, meaningful, and experiential value to patients. I think that's really important. Okay, so let's take a look at what that really means. When you take a look currently at the healthcare ecosystem, patients are engaging every day, burnt out, hurried, and in some cases, disconnected providers and staff. It's not because they're endemically disconnected. It's that the structure, the ecosystem of the healthcare industrial complex is so driven by patient volume. And by necessity, patients need access. So we have to see lots of patients. And as a result of that, it has transitioned into transactionalism instead of humanity. And in a time of the robot, developing systems that increase transactionalism is a really bad idea. So the first lesson I think here is that if we really want to understand patients, we need to stop transacting clinical care and start developing full duplex dialogue. In other words, two-way, real dialogue with patients to understand their experience. Because when we do that, we win. Now, what are some practical ways to do that? Some of the best organizations are leveraging what we call enterprise innovation. And they create platforms called ESNs, or enterprise social networks. And they develop innovation challenges around patient engagement and patient experience. So for an example, they'll do a challenge that says, how can we glean better insights about the underserved communities that we serve so that we can do a better job of understanding their language, their cultural differences, and so on. And from those patient-facing stakeholders, that's where the rich data is. It's not in surveys. It's not in so-called voice of the customers. In fact, we use a method called the soul of the customer. The key here is that we need to develop a program that is looking at what insights we need from the patient so that we can then create the innovation activity using collaborative ideation. And then we put all of that into an enterprise social network. Now, enterprise social networks are really think of an internal Facebook. The difference is we use gamification and we use social engagement. I know I'm using a lot of buzzwords here. All it is it means let's create a fun challenge. Let's gamify it so that we can get patient-facing stakeholders to want to play the game of patient engagement innovation. It's really the only way to do this. Surveys are easy. Surveys create great charts and graphs. I mean, they're awesome. The problem is they're erroneous. They're fractional, and they don't provide actionable insights. And that's a big problem. So I think that one of the first lessons here is that let's take a look at the science of patient engagement as an innovation activity, which it is. And if it is an innovation activity, then what is innovation? Innovation is collaborating with problem, opportunity, and patient-facing stakeholders so that we can glean unique real-time insights about what is going on so that we can improve the way in which we engage those patients. Okay, well, before I leave the discussion of human experience innovation, I also want to point out the fact that unhappy employees, staff, and providers deliver bad experiences. And they're bad in two major ways. Number one, they're bad because they're not gleaning insights necessary to improve patient engagement. And number two, hurt people hurt people. When we have staff and providers that are suffering from burnout and living a dystopic existence, they're not likely to engage the patient. So, I mean, come on, obviously we have to fix that. And that's where human experience innovation comes in. We need to be able to improve the experiential journey for our providers and staff while concurrently improving the experiential journey for patients. All right, now here's another bold proclamation. Patient engagement is a derivative of patient experience. We talk a lot about patient engagement, but patient engagement is instructed by the way in which we develop experiences. So if you think about any of your friends or any other relationships you have, the way you engage them is based on the way you experience them. I hope that makes sense. I think that we have to be really careful about realizing that engagement is downstream of the experiential value that we deliver. And I'll try to prove that in these three elements that make up patient engagement. Okay, so the first element is that we have to look at personification. Historically and sadly, when we looked at patients, we would always look at them from a market demography perspective. In other words, they were Hispanic, they were at a certain economic level. We even have majority of health systems and organizations looking at patients based on how they pay for services, which is horrible. In other words, what I'm suggesting is market demography, trying to dissect people into market demographics in the personification of patients is not only bad in terms of getting to the end game of improving engagement, I think it's also dishonest and prejudicial and just wrong. We're all individuals. And I would suggest, and we talk about this in our patient champion certification training program, is that the only way that you can do this right is that you have to actually understand them based on the things they hate and the things they love. In fact, we call this hate-love personification. Usually we can break down our patients in about 4 categories of hate and love. When we understand that, now we can engage those patients in a way that we're alleviating the things they hate and improving on the things we love. That creates a better experience. That creates a human relationship. And from there, downstream, the derivative is, yes, you guessed it, patient engagement. Patient engagement is a derivative of better patient experiences. The only way we can improve experiences is we have to understand their hate and love personas. Now, that can get a little bit into the weeds, and unfortunately, I only have a few minutes left in this short orientation. But I do think it's worth your continued inquiry into that subject, hate-love personas. The other issue is that we oftentimes use journey mapping to understand the experiential journey of a patient, and then from there, we can overlay the downstream derivative of patient engagement. The problem is that most organizations don't really do a very good job of understanding the right way to develop journey mapping. And here's what I'd like to suggest. We do this. We break it up into 5 touch points. And this is from my best-selling book, What Customers Crave, and my other best-selling book, What Customers Hate. And what we've discovered is there are really 5 ways in which patients engage health systems and healthcare in general. Number 1 is what we call the pre-touch moment. The pre-touch moment is the moment where they're in the discovery phase. So when we think about the discovery phase, we have to ask ourselves, we serve a range of patients. Are we thinking about the cultures, the languages, and the hates and the loves across our 4 personas as we build out those pre-touch moments? The other important thing about pre-touch moments during the discovery phase is that patients need to be able to understand how to access care. And we need to find ways to engage them there. And again, there are tools to do this. There are strategies to do this. The next touch point is across their journey is the first touch moment. The first touch moment is heavily weighted, meaning that they determine if they're going to have a relationship with you and if they're going to like you and therefore engage you during this first touch point. This can be the way in which they register at a front desk to get clinical care. These are all very, very important if we really are sincere about wanting to develop far better strategies related to engagement. The next touch point is the core touch point. This touch point of their journey is what it's like to basically do business with you. What are the day in and day outs of being able to engage your hospital or clinic or your medicine or your device? This is really, really important, and it has to be thoughtfully architected because within the core moment, there are micro moments that have to be looked at. The next touch point is what we call the last touch point. This is the way in which we disengage with them. And again, this has to be very carefully architected. And then the very last touch point is what we call the in-touch moment. And this is how we use technologies like CRM to be able to stay in touch with that patient in a very customized way, really to ensure that we're maintaining the relationship and maintaining the proper continuum of clinical care. So that's what the journey map looks like. So we're delivering experiences that result in engagement across the 5 touch points of the experiential journey across a range of approximately 4 hate and love personas. Those are the 2 dimensions of this 3-dimensional chest. Okay, the next one is what I call the baseline level of expectation. The overwhelming majority of organizations really don't understand what their patients expect. If they do understand it, They actually deliver services and engagements and care at their baseline level of expectation. We know that in almost every other industry, that if you're at the baseline level of expectation, you will ultimately fail. Giving a patient what they expect isn't good enough in a time of patient consumerization. Patients view healthcare today the same way that they view any other consumer product. They want you to delight them with human engagement. Remember, in a time of robotics, being robots are a really bad idea. And I can say that the overwhelming majority of healthcare systems are delivering healthcare as a transaction. They transact care. They don't engage and deliver beautiful experiential moments. And the only way to fix that is get real insights that go beyond surveys and VOC so that you can then create a HXI strategy that really drives what is necessary. Because remember, we have to hit the two hemispheres of experiential value, which means improving the value for providers and staff while concurrently improving the value for the patients across the 5 touch points of their experiential journey. Understand their baseline. That's the very bare minimum, and we invent above the baseline. So those are your 3 dimensions of human experience innovation. Understanding the hate-love personas. Walking across the 5 touch points, the pre-touch, the first touch, the core touch, the last touch, and the in-touch moments to be able to invent well above their baseline level of expectation. Look, I know that I may be rocking some boats with some of these new methods. It's easy to do surveys. It's easy to use methods that were created in the 70s and 80s. But if we really want to move the needle, if we really want to drive patient engagement, there's a new science out there. It's working with mathematical certainty, and that's what I'd like to share with you during my presentation. I hope you found this recording helpful, and I'm looking forward to meeting everyone at the event.